Alyson Gonzalez. I go by Allie. I am 19 and the mental disorder that I have is bipolar type 2. I've had bipolar type 2 since I was 13, so for 6 years I've been seeking treatment. I do talk therapy every Tuesday. I'm on oxcarbazepine, and my emotional support animal, my cat, Salem. He gives me a reason to wake up every day because he needs to survive. Bipolar disorder is a mood disorder that has periods of highs and lows. I would say since I've had treatment and I've been on medication for the past couple years, my day-to-day life is relatively okay. You can get a little lost in a fog almost. Sometimes your memory just doesn't work. Sometimes it's hard to focus on the priorities that I have because everything kind of gets lost. With bipolar type 2, I can have periods of manic episodes, but we have something called hypermania, which are shorter, a little bit more manageable manic episodes. They're more elevated. Sometimes you can be a little bit more argumentative, high energy. Oftentimes it's when I pick up a lot of tasks, I put way more things on my shoulders than I can actually handle. With depression, I feel that is the most commonly displayed symptom of bipolar. It's oftentimes I feel very confined to my bed personally. I don't really want to get up or see the world. Oftentimes suicidal thoughts follow in suit. Usually the longer a period of mania is, the harder the depression is. I still struggle with trying to hide my diagnosis. I want to seem as normal as possible, but it's a little bit of a struggle. It's kind of just like a dark place. I would say on average, a period of hypermania or mania or depression lasts probably about a week. I have had my longest manic episode last 2 weeks. You can have mixed periods of mania and depression. I would say those are probably the worst ones, but they also give you a sense of normalcy. Bipolar is something that is genuinely in your brain. My neurons fire differently than somebody who does not have bipolar, which thus can lead to maybe slight changes with your relationships with others. My parents were very supportive. I mean, we were speculated that I had bipolar from a very young age. It's just you can't be properly diagnosed until you're in your teens. They're very much by the textbook and not understanding at the same time. I'm not a patient, I'm a growing adult. I have autonomy, so that was often removed. But overall, they were very supportive. They encouraged treatment, they believed in the treatment. I got most of my support kind of from my friends, more in high school than growing up. They didn't fully understand what it was, they just knew that they needed to be a support system. Having a strong support system outside of my family is very important. I feel education is the number one, and understanding treatment is necessary. It's not something you can just be diagnosed with and go on about your day or take some medicine, you're okay. You need to actively try to better it because it's a chronic illness.